Doctors of Reddit, what was a symptom a patient didn't mention that was really important? Medical intern here, had a woman come to ER complaining about stomach pain, took her full history, did the exam and vitals, she seemed fine, mild fever. Made a preliminary diagnosis of gastroenteritis and presented to my doctor. My doctor, who is female, goes to her and asks why she came to ER for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did. She said it was fine, and I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response: didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy and possibly surgery. Bro, as someone with Crohn's, I talk about my shit like an epic. I have the whole Iliad of the story of my bowels down. I have UC and I do the same, it's the FKN worst with a flare-up. I'm constantly looking to check if there's blood, and I don't think there's a person in my immediate family who doesn't know about my bowels. I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. This is terrifying. Holy shit. Alcohol withdrawal is no joke. It can kill you. I've been there and it really is serious shit. It's absolutely misery, it's like you can feel every part of your body dying. I really wouldn't wish it on someone, but if anyone reading this is even a little concerned, go to the damn hospital, because it only takes one bad withdrawal to kill you or fuck you up bad. They can get you out of it safely and will monitor you constantly. Black stools. Folks, if you're having black poops, FFS, mention that sooner rather than later. That lady has been seeing nothing but black for months before she thought to mention anything. We found several gastric ulcers and a hemoglobin level that circled the drain. But also mention if you're taking any iron supplements, or Pepto. They can cause alarmingly dark stools as well, but in that case it's harmless. As can eating a lot of Oreos. Also, beets and Trix will both make your poop look like it's covered in blood. I once ate too many Oreos and was super alarmed when my poop came out black. Chest pain. Guy denied ever having chest pain, ever. Told us he was able to chop wood and work on his land without any issues. He didn't meet any criteria for additional workup prior to surgery. During his major surgery he had a huge heart attack. A cardiac cath showed that he basically had one very narrow coronary artery that was the only thing getting blood to his heart. His daughters, who were nurses, all swore up and down that he was healthy as a horse and never complained of heart issues. Then his black sheep other daughter arrived and said he actually had told her that he terrible exertional chest pain every time he did anything, but that he didn't want his other daughters to know because they would worry. He died a few days later. If we had known about his symptoms, he would have likely had his cardiac disease diagnosed and treated prior to surgery. Edited for typos, was on mobile during a break at work and didn't notice them until now. Edit 2, Since this post is getting a lot of attention, here is an informative article about chest pain from the Mayo Clinic. It's important to note that women and people with diabetes may not have the classic symptoms of cardiac chest pain. The American Heart Association summarizes some of these differences here. Edit 3, thanks for the coins. And I'm sorry, but I can't give medical advice over the internet. If you are concerned about symptoms you or a loved one may be having, go to a doctor please. I'm a med student and on my family medicine rotation I was sent to see this woman before the doctor and get a history and physical. She was saying she was having heartburn and just wanted us to give her something to throw up so she will feel better. I thought it was odd and so I went through some more review questions and she said her reflux pain was extending up to the left side of her neck and down her left arm. And that she had been sweating for hours. I cut off the interview short there and went to my teaching doctor to tell him everything and what I thought. Got an EKG. Yeah, she was having a heart attack, had to call an ambulance and get her to the ER. For your entire career don't forget this case. I'm an ER doc. All epigastric pain is an MI until proven otherwise, especially in diabetics and women. I had a patient whose main complaint was a wrist sprain. Asked how he felt and he said he felt lightheaded and fell down the stairs. After about 15 minutes of questions about his heart and other stuff, I asked him if he's had any vomiting. He said he vomits every day. I asked if it's red and he said it's bright red every time. The kicker is this was his usual yearly appointment. Dude was vomiting blood every day and not only did not go to the ER, he didn't feel it was worth mentioning at his checkup. So what was his issue? Obviously vomiting blood is not okay, but why was he vomiting blood? I think it ended up being a lower esophageal bleed. I'm a doctor. These stories are from a few years ago when I saw patients. I'm a medical intern, working the ed. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed, procedure in the morning. I'm about to queue up some nitro paste. It's a cream you put on skin that helps get blood flow to the heart, as my resident had seen him first and said it was okay, and I went through the contraindications as it was just habit at this point. One of them is recent Viagra use. Patient had said no to recent Viagra to my resident when his wife was there. He said yes to me when I asked when his wife wasn't there. He wasn't using it with his wife. Nitro paste was avoided, blood pressure stayed okay, coronary got stent in the morning, discharged the next day. Pro tip: while you toss the family out to do the rectal exam, ask all the questions they won't answer honestly. Remember to subscribe for more daily quotes.